cracking knuckles, how often you should be going to the bathroom, and the big debate, heating or icing an injury. Yep, today we're diving into 5 of the most highly sought after Googled health questions on the internet. And some of these may just surprise you. So let's dive right in, shall we? Number 5, is it normal to poop once a day? Yes, but also no. There's a wide range of what's considered normal when it comes to a bowel movement. Some people go 3 times a day while others go 3 times a week. As long as you're comfortable and not experiencing any discomfort, you're probably fine. Factors that influence frequency: diet. Fiber is a huge factor. People who eat more fiber-rich foods like fruits, vegetables, and whole grains tend to have more regular bowel movements because the fiber adds bulk to the stool and helps it pass more easily. Hydration. Water is also crucial for digestion. Staying hydrated often softens the stool and helps prevent constipation. Not drinking enough water can slow things down. Exercise. Physical activity helps keep things moving in the digestive tract. People who are more active often experience more regular bowel movements. Stress. Believe it or not, stress can mess with your digestive system. Stress can either speed up your digestive system, leading to diarrhea, or slow it down, causing constipation. Also, medications. Certain medications such as painkillers, antidepressants, and even some supplements can affect bowel habits. While bowel habits vary, there are some red flags to watch out for. If you notice drastic changes in your bowel movements, such as suddenly going more or less frequently than usual, or if you're experiencing symptoms like severe pain, blood in the stool, or very dark stools, it's important to see a doctor. These could be signs of underlying conditions like irritable bowel syndrome, IBS, inflammatory bowel disease, IBD, or even gastrointestinal infections. But a good rule of thumb is typically 1 bowel movement a day. If things change drastically, it's good to check in with your doctor. Alright, be honest, how often do you go to the bathroom? Let me know in the comments below. Number 4, is cracking your knuckles bad for you? I get this all the time. No, cracking your knuckles does not cause arthritis. The popping sound comes from the release of gas bubbles from the fluid within the joints. This fluid, called synovial fluid, lubricates the joints, making movement easier. When you stretch or twist your fingers, the pressure in the joint changes, causing little gas bubbles to collapse, which is what you hear as you crack or pop. But here's the catch. While knuckle cracking itself doesn't damage the joints or lead to arthritis, doing it aggressively or frequently can irritate the surrounding tissues. Over time, you might experience some discomfort, swelling, or reduced grip strength, although this is rare. If cracking your knuckles causes pain or your joints become swollen, it's a good idea to get checked out by your doctor, as this could be an indication of an underlying issue unrelated to knuckle cracking itself. In conclusion, it's more of an annoying habit for those around you than something that harms your joints. But keep an eye out for discomfort. If you notice any pain or swelling, it's worth getting checked out. Do you crack your knuckles? Let me know in the comments. Number 3, can you catch a cold from being cold? The short answer, no. Colds and the flu are caused by a virus, not directly temperature per se. However, the reason people often believe that being cold can cause a cold is because historically, colds tend to spread more during the colder months. But here are other factors that are really happening. First, cold weather and indoor crowding. Think about it. During colder months, people spend more time indoors, in closer contact with others. This increases the likelihood of spreading viruses like the cold and flu. So it may not be exactly the cold weather itself, but the increased exposure to germs in an enclosed space that raises the risk of getting sick. Secondly, the dry air. Cold air is often drier, and then when we heat our homes, the air can become even drier. Dry air can dry out the mucous membranes in our noses and throats, which are our body's first-line defense against viruses. When these protective barriers are compromised, it becomes easier for viruses to enter and cause infections. Lastly, the weakened immune response. While cold temperatures don't directly cause a cold, some research suggests that the exposure to cold temperatures may temporarily lower your immune system's effectiveness. This makes it slightly harder for your body to fend off infections. However, this is a small effect compared to other factors like being around sick people or touching contaminated surfaces. So it seems true because colds are more common when it's cold out, but the real culprits are the factors like the virus itself, indoor crowding, dry air, and slight immune suppression. So, as we head into the colder months, try to increase factors that will keep your immune system stronger. Number 2, can supplements really boost your immune system? Yes, certain supplements can help support your immune system, like vitamin C, zinc, and vitamin D, for instance. Vitamin C. This is probably the most famous immune boosting nutrient. Vitamin C supports various cellular functions of the immune system, including the production of white blood cells, which help fight infections. It's an antioxidant, which means it helps protect cells from damage by free radicals. However, once our body has enough, extra vitamin C won't necessarily give you a stronger immune system, so keep that in mind. And I mentioned zinc. Zinc plays a key role in immune cell development and communication. It's particularly important for the maintenance of the skin and mucosal barriers, which are the first line defense against pathogens. A zinc deficiency can impair immune function, but taking more than you need doesn't lead to extra protection. Also, vitamin D. Vitamin D is crucial for immune regulation. It enhances the pathogen fighting effects of monocytes and macrophages, white blood cells that are important parts of your immune defense. Low levels of vitamin D can be associated with increased risk of infections, especially respiratory ones. So although they're not a magic bullet, there are a lot of factors involved. For instance, a healthy diet, regular exercise, good sleep, and low stress levels are the best bet for a strong immune system. And with that said, if you're looking for a little extra support, my health company Life Happns has supplements like Do Not Disturb for sleep, which has 3 bioavailable forms of magnesium, L-theanine, among other ingredients that will help you get a better night's rest, which we know sleep is crucial for overall health, so definitely check it out. It's available on lifehappens.com and on Amazon. I'll link to it below. Number 1, should you use ice or heat for an injury? Whether to use ice or heat definitely depends on the type and timing of the injury. Let's break it down, shall we? First up, ice or cold therapy. When to use it. Ice is best for acute injuries, those that occur within the last 24 to 48 hours. This includes things like sprains, strains, or bruises. How it helps? Ice reduces blood flow to the area, which helps minimize swelling and inflammation. It also numbs the area for pain relief. How to apply? Use an ice pack or frozen item wrapped in a towel for 15-20 minutes at a time, with at least 1 hour between applications. Also, remember, don't put the ice directly on the skin because this can cause tissue damage. Use a towel or something to help. Now, on the flip side, let's compare it to heat or heat therapy. When should you use it? Heat is best for chronic injuries or ongoing muscle pain, stiffness, or tension, like muscle soreness after a workout or long-standing joint pain. How it actually helps? Heat increases the blood flow, which helps muscles relax and encourages healing. It also reduces stiffness in joints and muscles. How to use it? Use a heating pad, hot towel, or take a warm bath. Apply heat for 15 to 20 minutes, but also avoid using it on fresh injuries as it can worsen the inflammation. Combining both. For some injuries, people use a combination of both heat and ice, known as contrast therapy. It helps stimulate blood flow while controlling inflammation, though it's best used under guidance from a healthcare provider. So the rule of thumb, if the injury is fresh or acute, go for ice. For stiffness or chronic pain, go for heat. And if you're unsure or if symptoms persist, always consult your healthcare provider to ensure you're getting the right treatment. There you have it, 5 of the most Googled health questions answered. Remember, no question is too silly or dumb when it comes to your health. If you're curious about something, always feel free to ask your doctor or put it in the comments below. And if you're looking for more tips on staying healthy, be sure to check out this playlist right here. And as always, if you're interested in supplements that support your overall health, check out our website, lifehappens.com. Our supplements are designed to be fast acting and go after real life problems like occasional stress, help with better sleep, more focus, and liver support and hydration. If you are interested in a guideline or list of supplements that can help your overall well-being, I put together a free supplement list and guideline for all of you out there if you're interested. I'll put the link in the description below if you'd like to download it. If you found this video helpful, hit that like button, subscribe, turn on your bell notifications, and thank you so much for watching, and stay healthy, my friends.